the compassionate care bill. You have brought that bill up in the past more than once. You are not a co-sponsor this year.
No.
What has changed?
Well, I was not asked to sponsor the bill this year. I am a mother of a son that died of AIDS. That time for me was a very difficult time. And I looked after his death. I have worked with mothers and parents of children dying of AIDS and have seen the pain that they've gone through. And if I had had the opportunity, if that had been available to me, that remember this is medical use, then I certainly felt that at least it would have provided some of the relief for my son and other individuals.
Do you think that bill has a chance in the Senate this year?
Let me say that the bill's chances of even coming out of committee, it came out of committee before. It came out of committee to a subcommittee. And at this point, if as controversial as individuals would deem it to be, I would say that I would not say that that would be a #1 focus, because I think the focus within the legislature is mainly going to be whether or not we have enough money to even develop the budget that we need.
Do you think overall that the drug policies we pursued in this country have been effective, have been fair in the past?
Drug
The
policies,
criminalization of marijuana. I believe you are co-sponsoring this year the salvia bill that would criminalize
That's
the
right.
use of that.
That's right.
Is that effective?
Is it?
It just seems to lock
The
away
drug
a lot of
policies,
people.
the drug policies, are they effective? Are there number, when you look at the number of individuals that we have in prison, majority of them, a large percentage of those are drug related. The policies that I think is most effective is one, to develop a rehabilitation plan to help them to address their issues and those concerns. I think that we have education, which is, we find that when individuals are well educated, better the chance of them getting involved in things that are illegal, a lot less. Same thing with living in a safe place, having a job. So those things I think are some of the things that address that issue of the use of drugs. Do we need to look at the drug policies? I think the Sentencing Commission is looking at issues that relates to in terms of sentences and those kinds of things. So that's a beginning. So yes, we do need to take a look at it, because when we look at what we have in the number of beds we have for prison versus the number of prisoners that we have, I think in every area we need to take a strong look at and determine how to best address that.
The prisons, that also enters into the budget. There are fixed costs that you folks have to meet.
Right.
Prisons being one. Do you think there are more cost-effective ways to deal with offenders, not just drug offenders, but I know Sue Bell Cobb, since she's been Chief Justice, has talked about changing the way the courts do things so that you don't just automatically throw everybody in jail.
That's right. And I agree with that. As a matter of fact, she has a task force or commission dealing with drug courts to make sure that every county has a drug court. And I think that's an excellent approach. We passed the juvenile reformation of juvenile codes on last year. An excellent way of dealing with juvenile issues and providing the resources or the necessary support that they may need to prevent them from becoming a statistics in prison.